Hello and welcome back to my channel. Today's video is going to be a serious one as we discuss the latest warning from the World Health Organization about fungal infections becoming a major threat to public health. Some experts believe that the changing climate is making environments more suitable for fungi, and this has caused an increase in fungal infections worldwide. In this video, we will discuss the latest study that looked at confirmed and probable cases of fungal infections reported to state and local health departments and the CDC between 2016 and 2021. We will also discuss the main types of fungal infections, their symptoms, and how they spread. According to the latest study, the number of fungal infections has risen from 1,310 in 2020 to 4,041 in 2021. The data from the CDC shows that fungal infections have caused 7,000 deaths in the US and 1.5 million worldwide in 2021 alone. The study found that cases of the fungus resistant to the antibiotic echinocandin had also risen. In 2021, there were about 3 times the number of cases than in each of the previous 2 years. The most common types of fungal infections are Candida, Aspergillosis, and Pneumocytis, and they were responsible for more than 75,000 hospitalizations in the US in 2021. The main symptoms of fungal infections are fever and chills which do not improve. The fungus can cause many different kinds of infection, such as in the bloodstream, wounds or ears. The mortality rate depends on the state, but ranges from 30 to 60%. It is spread through direct contact and may also be passed on via contact with contaminated surfaces or equipment. People catch the fungus through physical contact with an infected person. The fungus kills more than 1 in 3 people with invasive C. auris, where the fungus has caused an infection affecting the blood, heart, or brain. Patients who are already sick and have multiple conditions, or are on ventilators, are most at risk. Lots of the early cases of C. auris in the US were imported from abroad, but the majority of the cases in recent years have been due to local transmission. New York City and Chicago were worst affected, but cases of the fungus have now occurred in over half of American states. A total of 3,270 clinical cases and 7,413 screening cases were recorded between 2019 and 2021. Before that, cases rose from 53 in 2016 to 330 in 2018 and then increased 44% to 475 in 2019. Clinical cases kept on spiking each year, growing to 756 in 2020 and then almost doubling to reach 1,471 in 2021. Screening cases also increased, essentially tripling from 1,310 in 2020 to 4,041 in 2021. 3 states, Oregon, Minnesota and Michigan, all reported their first case of the fungus in 2021. Meanwhile, areas with previous cases but limited spread, such as California, Texas, and Florida, had new and increasing transmission. Between 2016 and 2021, the number of confirmed and probable fungal infection cases reported to state and local health departments and the CDC increased significantly, from 1,310 in 2020 to 4,041 in 2021. This rise in fungal infections is becoming a major threat to public health, according to the World Health Organization. Experts claim that fungi are becoming more common worldwide due to the changing climate, making environments more suitable for them. This increase in fungal infections is likely to be exacerbated by the strain on healthcare and public health systems caused by the COVID-19 pandemic. One of the most concerning fungal infections is Candida, which caused 1,769 deaths in the US in 2021. Aspergillosis caused 1,236 deaths, while Pneumocytis was responsible for 449. Fungal infections were responsible for more than 75,000 hospitalizations in the US in 2021, with Candida causing the most, leading to the admission of over 26,000 people. C. auris is a particular cause for concern, with 2,377 clinical cases and 5,754 screening cases reported in 2021. The fungus is highly resistant to antibiotics, and in invasive cases, it has a mortality rate ranging from 30 to 60%. While many of the early cases in the US were imported from abroad, the majority of the cases in recent years have been due to local transmission. The fungus is spread through direct contact and may also be passed on via contact with contaminated surfaces or equipment. Patients who are already sick and have multiple conditions or are on ventilators are most at risk. The increase in C. auris cases reflects deficiencies in early identification of cases and implementation of infection prevention and control measures. The researchers suggest that the lack of uniform screening across the United States may lead to an underestimation of C. auris cases. The growth in C. auris cases may also have been exacerbated by pandemic-related strains on healthcare and public health systems. In conclusion, The rise in fungal infections is a significant public health concern. With Candida, Aspergillosis, and Pneumocytis causing numerous hospitalizations and deaths, and auris posing a significant threat due to its resistance to antibiotics, it is essential to implement effective infection prevention and control measures. And that's a wrap for today's video on the concerning increase in fungal infections and the potential reasons behind it. It's important to stay informed about the threats to public health and take necessary precautions to protect ourselves and our communities. Thank you for watching, and if you found this video informative, please don't forget to hit the like button and subscribe to our channel for more updates on health and science.